Hi there, viewers at ONA Internet Land. Thank you so much for joining us today to watch the presentation of the 2020 ONA Roadshow. My name is Whitney Wong, and I'm the Chief of Staff at ONA. In that capacity, I work with our ONA member leaders in governance and help them achieve their priorities. I'm really excited today to share the ONA Roadshow with you. The Roadshows are a time when our leadership gets to talk to members about the really important work they're doing and what they see as being the most crucial priorities for ONA coming up in the near and far future. I'd like to introduce Tammy Klein, who is our treasurer from our board of directors today, who will talk to you about ONA's legislative priorities.
Thanks, Whitney. So as Whitney said, I'm Tammy Klein. I'm from Good Shepherd Medical Center in Hermiston, Oregon, and I'm here today to talk to you about Oregon State Legislature and the progress that we're making in the legislature right now and the bills and wants that we're looking at for the nurses. So the Oregon short legislature session this year runs from February 3rd through March 8th. And you might wonder how we come up with decisions of what we're going to back for ONA and what we're going to go out there and try to push to get passed. Well, ONA's Cabinet on Health Policy members, they research the healthcare issues in our state and determine our legislative priorities. And that's what ONA bases their support for. So this year, there are three pushes that ONA is really working towards that we would really like to see push through our legislature. The first push is we would look for an increased enforcement in the nurse staffing law. As all of you know, if you've ever made a complaint to OHA, it takes months to get that complaint even addressed, much less anyone to come back and talk to you about it. They are so overwhelmed at this point right now with just the audits that they're doing at the hospitals that they don't have time for everything that's going on. But not only that, they don't have staff for everything that's going on and all of the demands that the nurses are having right now. So with this, we are working to increase the number of meaningful state staffing law investigators and decrease the OHA's response time to staffing complaints. So this bill will increase OHA's staffing budget in order to hire more highly trained field investigators and staff to accomplish this for us. The other push that we have is right now, prescription tax in Oregon it's just out of control. And I mean the prescription cost to our patients, it's just out of control. So the next law that we would like to get passed for bill is to make prescriptions more affordable to the Oregonians by allowing us as the state to purchase and import affordable prescription drugs from Canada and then to distribute those out through the Oregon pharmacies so that that savings could be passed along to the patients. And the last law, and this is one of the big ones that we're really, really pushing for, is to reduce youth nicotine, the use by using the e-cigarette access. This would eliminate underage purchases and require buyers to present ID in person. It also would end the ability for them to purchase online and have it sent to them in the state of Oregon. So we're also leading a ballot measure to reduce the youth nicotine use in November of 2020. And that ballot measure will be Referral 402. And the reason that it's a referral is because last year in the legislature it was already passed. So it was challenged after it was passed. And so we have to bring it towards out to the public and to the people for their vote in November. So what we're asking for nurses and families and friends to vote yes on this Referral 402. So the reason that we're leading this change right now is because there's a few reasons. If voters approve of this ballot in 2020, the tax will fund Oregon Health Plan and support public health programs to help smokers quit. And as you all know, that work in a hospital or even a clinic, how many people come in with health-related issues from smoking. It also would help us in monetarily. So we haven't increased the tobacco tax for cost of living or inflation in years. And this would increase it for $2 a pack, still bringing us lower than California and Washington at this time. But it would also help us to fund the coffers, and that's the whole idea of this. The e-cigarettes is the fastest growing tobacco product, and they're not taxed at all in the state of Oregon. So you might ask why we're so interested in doing this besides all the deaths that keep happening on TV after such a short time throughout the United States. So many kids are even affected by this. is that this proposal would help to prevent 19,000 kids from taking up smoking, and it would also help 31,000 Oregonians quit smoking. And the reason that we know this is that we've done measures and statistics and figured out by doing surveys that 4 out of 5 Oregon smokers want to quit, and 1 to 2 smokers will try to quit every year. What happens is this will also make it a critical long-term investment in the Oregon Health Plan. So right now, due to the federal investments in Medicare, the OHP has an estimated $215 million funding gap right now that they haven't got a way to make up for this gap. And this taxing on the e-cigarettes and on tobacco would help to shorten that gap so it's not quite so big, which ultimately would come back and help our patients that we're taking care of in the hospital. So we do ask you to get out and vote in November and have everyone else get out and vote in November to get this passed, because as we know, it's an important and vital thing. But if you do have any questions, you can get a hold of Katie here at ONA, and she can answer any of your questions. But what we really, really encourage is come to convention and make a difference on this, because you do have a voice and you can be heard throughout Oregon.
Next, I'd like to introduce Diane Solomon, who's a director on our board of directors. She's going to talk to you about the statewide election and why it's important to be part of ONA on a larger level.
Thank you, Whitney, and hello, everyone. So speaking of elections, it is the ONA election season, a very exciting time. Nominations opened up on January 1st. They're open a bit longer till the 8th of February, and then you'll be getting emails and notifications about the election by February 24th. The election will remain open through the first week in April, and new members take their offices in July. So it's really important both to vote, but also to nominate yourself and your friends for open positions. There's positions on the board, several director positions, president and secretary are open. There are positions on the nominating and elections committee, and virtually every cabinet has openings for nominations and new members. So whatever your passion is, you can find a place where you belong at ONA and where you can really add to the discourse. Here's a lovely quote by Caitlin Reed, former ONA treasurer, and all of us who are member leaders do this for various reasons. For myself, I am on the ONA board, and I'm also health policy chair for Nurse Practitioners of Oregon. And this work that I do for ONA and NPO is some of the most meaningful work I can do to really help all nurses and nurse practitioners rise and get a greater voice and more power as nurses in our workplaces and in our communities. We all know that nurses are the most trusted profession, and it's time for us to take our place really in every boardroom and every venue where healthcare decisions are made. So nominate yourself and your friends, and be sure to vote for ONA member and board and committee and cabinet positions. And if you have more questions or you're going to nominate yourself or someone you know you would be great, go to the OregonRN.org/elections page and vote, vote, vote. Thank you.
So I'd like to talk to you today about ONA's organizing victories and some staffing changes that we have happening in the next few months. I've been at ONA for 5 years now, and this has been one of the most exciting times to be here in terms of organizing. We've organized many new groups and facilities over the last year, notably the Unity Center for Behavioral Health. It's a big victory, and they're currently in their doing a new contract campaign. Also Willamette Valley Medical Center nurses, and St. Alphonsus Baker City Techs are another group we organized. The latter is the first group of allied health workers to be newly organized at ONA. So again, really exciting time to be part of unions and be part of nursing and be involved in the movement. We also have a big staffing change that's happened recently. The board of directors interviewed and hired Sarah Laslett to be the new executive director of ONA. Sarah has worked with ONA for several years in various roles. She's helped with some of our leadership conferences and our leadership trainings, but is really excited to be more involved as our leader and is deeply committed to continuing to grow our work and better serve our nurses and our allied health workers as well as our communities. Sarah comes to us from the University of Oregon's Labor Education Research Center. She also recently was up at University of Washington's Labor Education Research Center, so she has a long history working in healthcare, working with nurses, and working with unions and leadership. We're all very excited to have her come on board, and she will be starting full-time in March. So I hope that you all get a chance to meet her, but a great place to meet her will be at convention, which is May 18th and 19th, and we're going to talk to you more about that in just a moment. I'd like to introduce Sandy Kellogg, who's the chair of the Cabinet on Education. Sandy's going to talk to you about the ONA convention today. Thank you.
Thank you, Whitney. So yes, my name is Sandy Kellogg, and I work in Salem at Chemeketa Community College. So I represent the community college group of nurses. I am here to talk to you about probably one of the most exciting things we do, which is convention, May 18th through the 19th. Everybody can come. It happens every other year, so this is a wonderful event that we're all excited about. That being said, the first day of the convention, it's a 2-day event. The first day of the convention is going to be all about education. We're going to be learning all best practices, what's going on around the state. You earn CEs for this education. So it's a great time to get together and meet other nurses in the state that are coming in as well, and just participate with one another and getting your CEs completed. So we're really excited about that. It's a fun day of learning. I really encourage everybody to sign up and come to that. The second day of the event is when the House of Delegates come together, and you've already heard earlier in some of the presentations how important it is to become a House of Delegates or become a delegate and be able to participate in the second day of the event. We're going to be doing lots of different activities, but what we are mainly focusing on are the resolutions that we have and changing of bylaws. If there is any that need to be changed, which I believe we do have some. So I sit on the Cabinet for Education, and one of the resolutions that we're bringing forward is addressing the nursing faculty shortage. So how this happens is, as we on the Cabinet talk about the different issues that are going on around our state, we will develop these resolutions that we're going to bring to you as a delegate to look at, edit, and then finally vote on. And then once we get that vote passed, we'll then bring it back and start working with our stakeholders to address these issues. This one being the nursing faculty shortage, which is happening all over our state. Every single community college and university are struggling to find faculty to teach our nursing students. We need to get that done. So to talk a little bit more about the other things that we're doing besides the resolutions, we are also going to be looking at our bylaws and making any adjustments and house cleaning that needs to be done there. So one of the bylaws that we're proposing is updating ONA's structure to ensure that the board of directors can directly oversee each one of the cabinets, including the Cabinet on Economic and General Welfare. We hope that you will come and participate, get on and sign up to be a delegate, and come and vote. So delegate nominations close February 29th. It's time to get on the OregonRN.org/delegate website, put your name down, put your friends' names down, and then we will be voting on those delegates so that we can all come and enjoy the fun day of education and then being able to vote on these important issues that we have.
Thank you so much for watching the ONA 2020 Roadshow presentation. ONA is a member-led organization, and it's really important that members like yourself get involved in the topics that the folks presented for you today. We hope that you will come to convention. If you have any questions, please reach out to me personally at wong@oregonrn.org or go to the ONA website at www.oregonrn.org.